Now we demonstrate exercises for strengthening your muscles and enhancing your residual limb mobility. My name is Christoph Eckermann. I'm a physiotherapist at Otto Bock in the Competence Center in Duderstadt.
My name is Feridun Aksit. My leg was amputated above the knee 40 years ago because of a traffic accident. Back then, therapy didn't focus on strengthening muscles, but this is very important.
This is exactly why we're going to demonstrate exercises that you can do while you're still in hospital. Place your hand on the residual limb while raising it upwards. The residual limb is now pressing upwards, and you press against it with your hand. When I check here, I can tell that Feridun is applying counter pressure. You can hold this exercise for up to 30 seconds. Now you can lower your residual limb, then position your hand on the other side. Now you press the residual limb outwards and press inwards against it with your hand. It's very important that the hand is not placed too close to the end of the residual limb, because the end of the bone could press into the soft tissue and cause you pain. The same applies when moving downwards. The residual limb is pressed downwards and you press your hand upwards against it. Very good. And the last direction of movement is inwards. Position your hand on the inner side, push your residual limb towards the other leg and press outward against it. Exactly. Now lower your residual limb. You can do all these exercises for up to 30 seconds and you should repeat them up to 3 times a day. The towel exercise is another strengthening exercise. For this, you wrap a towel around your hips and pull the 2 ends together towards the middle. At the same time, press both thighs outwards and maintain the tension. If you feel strong enough, you can also lift your non-amputated leg. Now you have tension in the hip abductors, the lateral thigh muscles, the abdominal muscles, and the lateral trunk muscles. These muscles are extremely important for achieving a smooth physiological gait pattern with the prosthesis. Very good, Feridun. You can lower your limbs now. You can hold this exercise for up to 30 seconds and repeat it 3 times. And if you do this exercise every day, you'll soon see the results. Finally, we want to show you the cushion exercise. The cushion exercise strengthens the inside of your thighs. Position a wedge cushion between your thighs, press both thighs together and maintain the tension. Alternatively, you can also use a cushion from your hospital bed. If you have an artificial hip joint, please do not do this exercise before consulting a doctor or therapist. Thank you, Feridun.
You're welcome.
You can do this exercise 3 times for 30 seconds each, in the morning, midday and evening. All the exercises that we have just shown you are of course general suggestions. Please discuss them with your doctor, physiotherapist or hospital personnel, as they can best assess your individual situation.